is Barry Moore, and I am the CEO of ABC Medical Center. I want to take some time and thank you for being a part of our team, and I also want to say a heartfelt, grateful thank you for all the hard work that all of you do on a daily basis. I also wanted to let you know as we move forward in healthcare, one of our models wants to be patient-centered healthcare. In order to be able to do that, we need to find a computer program system that will help us to give excellent patient-centered care to both our community, our patients, and our staff. And I just am pleased to inform you that after many hours of testing and trying out different computer system programs, we have chose to go with the EPIC system. Now, the EPIC system is a worldwide group of healthcare organizations that collaborate around the globe in order to provide excellent healthcare to our patients. In order for us to be able to transition into this new system, first what we're going to do, we're actually going to ask for volunteers and have some of our very own staff members that will train to get extra training for this system, to be able to be better suited, better capable of helping us when the go live time comes. And why is that important? Because whenever you go to a new system, change is not easy. But if we have these people here with us, which we're calling super users, they will be by our side to be able, in our departments, to be able to help us to navigate this system more effectively. And then in response to that, we will also have the EPIC professional team, which will be with us side by side to be able to help us solve any kind of issues or problems that might arise whenever we go live and incorporate this new system. Once we go live, the EPIC professionals will be with us for approximately around 2 weeks to help us with any kind of issue, as I stated before. Once they leave, that will leave our super users to be able to help us to get more settled in with the new system. Also, the EPIC system will have a 24/7 response team that will be able to be there for us in case problems shall arise. EPIC has been around since 1979 and it started out with just 2 people, but now there are more than 250 million patients in their electronic health record system. That's pretty amazing. And just to even kind of talk a little bit about EPIC, they are the backbone for most of the largest hospital systems around the globe. And their application platform is always evolving. And why is that important? It's important because healthcare is always changing. New technology is always coming. New information about healthcare is always being discovered. That's why it's super important and super wonderful that the EPIC program system is always evolving to be able to include these things, to make us happy as staff members with its user-friendly interfaces, and also to provide excellent, high-quality, patient-centered care for our patients and our communities. And then one important fact I want to talk about EPIC is it actually has the fastest response time of any electronic record healthcare system in the business today. And why is that important? It's important because as we talk to our patients and get feedback and information from them, we can input that into their charts electronically and have a very fast response time, so we're spending less time at our computers and more time face-to-face talking and treating our patients. And that's very, very, very important. And speaking of technology, technology is always growing, okay? Along inside the EPIC system, there is a new application called MyChart. MyChart is a personal electronic record that the patients have access to. And why is that important? Because it gives the patients the ability to access the information inside their medical records. It gives them the ability to make doctor's appointments. It also allows them to do e-visits with doctors that before they would actually have to either take time off work or travel just to get there. And that's exciting news, that just with just a simple device, you now can be face-to-face with a doctor. And also, MyChart is even available when the patients are in the hospital, even at bedside, because when a patient is in the hospital, they're aware of what kind of test or an exam that they are going to get. But let's be honest, sometimes as a patient, when a doctor or a nurse tells you something, you seem a little bit afraid, or we can be timid to kind of ask, what does that mean, or what does that entail? Because we might fear that they might get upset, so we just remain quiet. But with the use of MyChart, no longer. If a doctor or a nurse explains a test or an exam to you, you now have access to be able to find out more information. What does this test entail? What does it do? What kind of results is it going to give you? And this will help give our patients peace of mind. It helps them to be more engaged into their healthcare treatment. Because when we come back to visit them, they may not want the exam, or they may want the exam. But that's the beauty of having the EPIC system, to help our patients be more engaged into the choices they have in their health care. When it comes to the phones and everything else, EPIC has 3 applications for each device. For the tablets, they have the Haiku app. For the smartphones, they have the Kanto app. And for your smartwatches, they have the Limerick app. Each one is designed specifically to help patients be able to access this MyChart, to be able to have the information wherever they may go. And that's a beautiful thing. Now you can travel to different states, different countries, and still have access to your medical records right then and right there. And that's important in case something happens while you're on vacation or you're traveling. Now we have instant access, so we can fill in the gaps. So if you do go to a different medical facility and need treatment, those physicians also have access to your medical records. So we're not just guessing about what happened or what kind of medications that you're taking. We can have access to it, and therefore there are no gaps in our medical treatment anymore. And on top of that, when we're using technology, there's now the telehealth care technology. And with this telehealth technology, it really opens up the doors for a lot of great services that we did not have before, such as the remote and rural area services. If you're out in the country somewhere, you can get help. There's teledermatology services. There's telecardiology services. We even have tele-emergency services. We also have interpretation services to help you speak the language that a patient may speak and you don't. We have ICU monitoring that we can do now. We have chronic disease management. There are patient transport services. We have virtual urgent cares that we can do now with this telehealth care technology. We also have one of my favorites, which is second decision services. If you didn't like something or whatever one doctor said, you can get a second opinion within that same healthcare system by using that service. And last but not least, we have financial counseling even through these telehealthcare services. And also on the rise of technology, we all know with the use of smartphones and tablets and things like that, we also have a huge use of social media. And social media is a great platform for us to be able to advertise and to train both physicians, staff members, and our community and our patients about different treatments or what's going on in healthcare. So whether it's Facebook or Twitter or Instagram, these are great social media platforms to be able to reach out deeper into our community, to deeper generations, and be able to continue to provide that patient-centered care that we so want to give to both our patients and our communities. And that's about it, folks. I am Barry Moore, CEO of ABC Medical Center, and thank you very much for your time.